fascinated by the stem cells as a doctor and as a patient. You think because you are a doctor that you know everything about medicine, which is completely false. Forget pharmacological drugs. Let's go to natural things. More than 18,000 clinical trials have shown stem cells are useful for your health.
We now have the DEA watching us with a magnifying glass. We physicians are responsible for the majority of addictions to at least prescription opiates. Patients are coming in very astute and aware of the risks associated with opiates. And as a physician, if you don't have alternatives, you're really falling short in their eyes. It's just plain good medicine.
You get so tired of being sick, having to take pills to put up with the pain. It's miserable. I didn't want to live, so I had one injection. It changed my life.
It's such a natural, organic kind of solution to manage pain. It's been an incredible journey, and I got my life back, you know? Yeah.
Welcome to episode 1 of Pain Revealed. I'm so happy that you decided to join us. When we make our docuseries at Revealed Films, it always turns into a magic carpet ride, leading us to places that we couldn't have guessed when we started out. Pain Revealed is no exception. There's a lot of pain and suffering in the world. People with acute pain, people with chronic pain, people who feel hopeless, people who don't feel like there's solutions for them. And in this journey, we have found things that, to me, were startling. The interactions that we have, the academicians that we speak to, the clinicians that we speak to, the patients that we speak to, you're going to see that there's a lot of rich content here, things that you might not have known about that can absolutely change your life. If you haven't shared Pain Revealed with a loved one or someone that you know or care about that you think can benefit from this information, please do so. This information is vital, and it's our purpose to bring this into the world, to increase the hope and possibilities that people who are suffering with pain can have. So episode 1 is going to kick us off. You're going to get some great information here. I look forward to the ongoing journey throughout this entire process with you. And again, thank you so much for being here with us. We have a fascinating story and interview for you here because we're interviewing a medical doctor who decided to get stem cell therapy. So Kasaya J is going to interview a French medical doctor, Dr. William Amzalag, and I think you'll be very enthralled with what you're going to find out.
William, it's so good to have you here. Thank you for joining us. Before we get started, why don't you just tell us a little bit about your background?
Hello, Kasaya. Yes, my name is William Amzalag, and I am a French medical doctor, specialized at the beginning at least in anesthesiology and intensive care. I am now 77 years old. I work a long time in surgery block in my town, which is near Nice, between Cannes and Monte Carlo. That's where I work most of the time. After that, I moved to America, to USA, and I stay about 7 to 8 years in Florida, in Boca Raton. Then after that, I come back in Europe, and I did several things, all related to health. This is why I speak English, but with a French accent. Please apologize. I apologize for my accent.
No, your English is fantastic. So you live in Nice, in France, but here we are in Costa Rica. What are you doing here?
Well, I'm here for stem cells. This is a big word, stem cells. I am passionate by the stem cells as a doctor and as a patient. You have to understand that I live with an immune disease, an autoimmune disease called rheumatoid arthritis for at least 30 years.
Wow.
And I did everything, you know, starting with anti-inflammatory drugs, cortisone, then I go to the big one, methotrexate, and of course I have temporary relief, but the disease was always and always progressing.
Yeah.
You know, you have to know that autoimmune disease, it's a cascade of inflammation going one after the other and disturbing and destroying joints.
Gosh, that sounds
one
painful.
After the other. It was painful, but most of that, it was creating a handicap.
So
Means if it's here, I cannot open here. If it's the ankle, I cannot walk. Of course, we have treatment, but pharmacological treatment, which have always side effects.
Yeah.
And I come to my age, and I said to myself, forget about pharmacological drugs. Let's go to what nature gives us.
Yeah.
Let's go to lifestyle. Let's go to natural things. And then I start to learn about stem cells. It took me a lot to understand what means stem cells and what is this revolution of regenerative medicine. And then I have a friend, Dr. G.M. Papa, with who I work, who was trying to convince me to go on a stem cells treatment, and I will explain you after what kind of treatment it is. That's why I am here today.
Okay. So what I'm hearing you say is you had a handicap, right? You had a disease or a disorder that was causing you pain in your life. So that means you're not able to do certain things that you could normally do on the day-to-day basis.
Correct. I was a sportsman, very active in my life, running. I was playing volleyball, playing basketball, even I was in the national team. So it was very difficult for me to realize that I cannot perform anymore.
Yeah.
Now, on top of the pain we can accept it or not, depending of the threshold where we are used to or not. But suddenly I find out that I have to stretch all the time. You know, if you stay immobile for more than half an hour, all your muscles are like trapped. Yeah. And you have to stretch and to stretch before even to move. So, you know, I was not used to that.
Yeah.
And it was for me difficult to accept that.
Sure. Yeah, I totally understand that. And what's interesting is you do have such an extensive background in the medical field. So when was it that you started being more open-minded towards stem cell therapy or these kind of treatments?
You know, being a doctor is good things and bad things. You think because you are a doctor that you know everything about medicine, which is completely false. So you start to self-treat yourself with what you have, but you are not a specialist. Of course, you know things, and you think you don't need a rheumatologist, for instance. And for years and years, I avoid to go to a rheumatologist. So I had to, at one moment, to delegate my own treatment to somebody else. Yeah. That's what I did. On the other side, I started to be very interested in natural medicine about 20 years ago already, with essential oil, with lifestyle, with food supplement, with natural weight management, all that. I was very passionate. So I go from very hard medicine, which is anesthesiology, where you use very, very aggressive medicines, because you put somebody in a coma and you have to bring it back to life. That's require a lot of drugs, dangerous one. Yeah. Then I go to another one, which was complementary medicine, or what you call traditional medicines. And especially I did a license of Chinese medicine, and I learned Tao. So I go from one extreme to the other. Yeah. It took me some years to go back to what we call the golden mean between the the harmony of the middle. So now I can use both as long as I know the pro and the con of both. This is why I come slowly to stem cells.
I see.
How can we use it? Where we can use it? I'll learn a lot from Dr. Giampapa, but from other specialists too. And I decided to go this way.
And you're here, and earlier today you had a procedure.
Sure.
So tell us about that. What did you have done?
Yes, I done it yesterday. This morning, I'm sorry, this morning. It took me a little time to accept that. I agree with everything about stem cells, but I was a little scared of receiving infusion or transfusion of cells which was not mine.
Right.
I mean, I was always afraid by rejection, issues, which can be very serious.
Yeah.
Now, it took me a long time to be convinced by Dr. Vincent Giampapa that what we call umbilical cord, which are adult stem cells, but from a newborn, are not mature enough to initiate immunologic reaction when it's infused. So, of course, I didn't believe him like that. I need some scientific proof. That's what I did.
Yeah.
I go and search and find out that what he said was true. Also, the facts show me that it was true because there is some doctors in the world, including Dr. Giampapa, which are doing umbilical cord transfusion and which have a lot of experience. Mm-hmm. When I say a lot, is thousands of people without any adverse effect. So that was my first conclusion and my first reason to come here. The second one was the handicap. Until now I have handicap on the upper arms, here and the knee, here and the elbow and the twist. It was okay because still with that I can live. When I started to have handicap on the ankles, that's another problem because you cannot walk like everybody. Sure. You have handicap here, you cannot go up, go down, the stairs is a problem. This is why what Dr. Giampapa proposed me was very good, which was combination of umbilical cord infusion. Then they took the fat, take some very special stem cells from the fat, and with the fat.
So they took your fat?
Yes, they took my fat and re-injected at a very precise place in the two ankles. If you want, I can explain on detail what's going on.
Okay, so you're here in Costa Rica. Dr. Giampapa treated you this morning.
Yes.
Walk us through what you had done.
Well, first is assessment, and I have been with a specialist in ultrasound, which go to my two ankles with very special, technical, up-to-date ultrasound system, which show me exactly where the damage was. The point for him was to find out where to shoot and what quantity of fat to shoot. Once he did that, I go to the surgery block, and then the first thing that they did is to take the fat. Now, this is what we call liposuction. But it's a special liposuction. It's not any kind, because if you want to go liposuction to take fat for weight loss, it's a kind of machine which is very violent because it's a suction, a real suction with something strong. Now you have to go manually. Means you have to put a needle and you take it gently, the fat, in order not to destroy the content of the fat. That's what they did. They go slowly, and they know the quantity of fat that they have to take thanks to the specialist of ultrasound, which calculate how much fat you have to use in the two ankles.
So it sounds like they have all their technology down. They knew exactly what...
It's a very unique technology which gives you exactly, one, the number, the quantity of fat that you have to use. Second, where exactly to use it. Means I had 14 shots in the two ankles.
14 shots?
Yes.
Okay.
because they want to treat this part and this part and this part. And this is guided by ultrasound all the time, which means that when they inject, they see physically, visually, where the fat is going.
So you know it's accurate.
Very accurate. Not only that, they are not using the fat as it is. You know, when you take fat, the fat contains different things, many very interesting things. Now, what they do, they put this fat in a type of filter, but very unique filter, which micronizes the fat, which means that the fat is going to be re-injected in the joint at 100 micron, which is 1,000 less than a normal molecule of fat. Not only that, this fat molecule will include not only stem cells, but very special cells which are around the vessels, which are extremely good. And also another thing called stroma vascular fraction, and other ingredient and growth factors too, which are extremely beneficial for the junction. Of course, these type of things can be done only directly to the joint, to other parts, but not in the blood, because the fat cannot go in the blood.
Right.
Okay, on the same time, I have an infusion of umbilical cord stem cells. And that's what I was afraid about, you know.
Yeah.
Why? How can I receive stem cells from somebody else in the blood without having a reaction? But I saw the fact, I saw many, many things, and I find out that those cells are non-mature or not enough mature to initiate immunologic reaction from my body.
Yeah.
And that is a fact now, proven fact. No side effect based on thousands of umbilical cord infusion.
So what I'm hearing you say is while you were having this procedure, you got 14 shots. So those shots were the stem cell treatment direct to the areas that needed the treatment the most. But while they're going through that process, they also have you hooked up to an IV where you're getting a massive dose of these umbilical stem.
Well, several millions of stem cells.
Yeah.
So those stem cells, all these 5 million, will not be all active. Some will be lost, some will go in the lung.
Yeah.
And in the lung, they will do their job. They will release some good active ingredient, and some of them will go everywhere. Why I need these blood stem cells, this umbilical cord? Yeah. Because rheumatoid arthritis is a disease, a general disease. It's not only my ankles, it's my twist, my knees, my elbow, and my shoulder, everywhere, and even inside. So we cannot treat the problem only by direct injection, We can play and having the worst one treated, yes, but we cannot shoot everywhere. Right. So we need to put it in the blood because the blood is a highway. Yeah. So if you put it in the blood, the different parts of your body which are inflamed will send a signal in the blood, say, please come, please come. And then each time in the blood, some stem cells will go to the part where it's needed repair and regeneration. Some others will go there, some others will go there. I'm not sure that we have enough to treat all the inflammation, but we think that when these cells, these very special adult stem cells, will reach the target, they will reactivate what we call quiescent stem cells, means stem cells which are sleeping there, but they are there, but they don't work. Yeah. So they are going to activate them, which they will start to work, to divide, and hoping that this injection will cure my disease. I don't think it will cure and totally, because you have, on top of that, you have to go back to normal lifestyle.
Sure.
nutrition, physical activity, stress management, relationship management, and so on.
Yeah. I think it's absolutely fascinating that we can tangibly feel your energy. You just had this procedure done, the liposuction, 14 shots in your ankle, and this infusion, and you're sitting here, you've got high energy, you're glowing, you look amazing. How do you feel right now?
I feel fantastic. To tell you frankly, I don't want to tell them because they would be so happy. No, I feel really good. I didn't eat. Means I take only some fruits.
Yeah.
And I stayed 3 hours in the table,
Okay.
which for me is very difficult.
So the procedure was 3 hours for you.
3
essentially.
hours for me, but
Okay.
for me, 77 years with what you say, 77, we need to go pee-pee or whatever, you know. They can cut that if they want.
We should leave it in, really.
But we need to move also,
Yeah.
you know, a rheumatoid arthritis need to move his legs
Sure.
all the time.
Yeah.
So 3 hours without moving is quite embarrassing.
Yeah, I see.
But after that, my God. Well, is it placebo effect when it's immediate
Yeah.
or not? I don't know. And I tell you frankly, I don't care
Right.
if it's placebo or not, but it's
Exactly.
feel good.
Exactly.
It's-
So, I mean, your background in the medical field is extensive, and very clearly, you know, you're hopeful that something like this works, but you're also realistic about it may or may not cure you. What are your real expectations coming out of here when you leave Costa Rica? What's that going to look like for your health?
Well, being a medical doctor, I know that there is no treatment which can be considered as panacea.
Yeah.
So we never have 100% success, and we never have 100% failure.
Yeah.
Between them, the good thing is to go to the up line, you know, to have a decent result which can be considered by success. 80% it will be fantastic because no one single drug in rheumatoid arthritis at least can reach 80%. No one single.
Wow.
So if I fail, it is okay. I will try again.
Yeah.
Means when I say fail, what can happen? No improvement. But I will try plan B. And I will come back for stem cells again because I am sure. Why I'm sure? Because stem cells are natural part of your body.
Mm-hmm.
Now, do you know that if we didn't have stem cells, we cannot live more than 1 hour?
Wow.
She's Karin Cormella who is saying that.
Yeah.
No more than 1 hour.
Wow.
So stem cells are a natural part of our body. What we are doing is bringing back some more young cells.
Yeah, that's so interesting. So I love your approach too, because I try to live like a really holistic approach in my lifestyle. And I think coming from a medical doctor who says, hey, I was doing all these things, you know, taking pharmaceutical, very hard drugs and decided that, hey, I was going to change my lifestyle and do these things. Well, now we've got stem cells and these are so controversial still. I think more as people get more and more educated, they're feeling more comfortable about the concept, but there's still a lot of scrutiny out there. So hearing you say that this is a holistic approach really to helping your body heal itself, I think is absolutely incredible.
This is science. What we are talking about stem cells is holistic because we're using natural ingredient to put back in the body. But this is science based on clinical trial. Very, very important. More than 18,000 clinical trials have shown by one way or another that stem cells are useful for your health. Now, this is a fact. After that, we can talk about regulation, health authority, big pharma input, or whatever you want, you see. But you have to understand that in life, the life made of stem cells means the first thing that we have when a man and a woman want to have a baby is that the spermatozoid will go to the ovula, will mix with the ovula, the DNA will mix together, and they will have the first magic embryonic stem cells. Now, these cells have a fantastic potency because with these cells, you can build your whole body. Now, After 4 days, the cells that you have will become adult. Until 4 days, it's called embryonic stem cells because they have the ability to be totipotent, means to have an unlimited potency. If you cut at this level, if you cut the group of 4, 6, or 8 cells, you can clone it. Means the two will become two baby with the same DNA. This is why it's not authorized, because this is dangerous things to do. But it's not authorized except for very special clinical research. Yeah. Now, after 7 days, the cells become adults. And this is the confusion with the people. The people think that adult means when we are 18 years old.
Yeah.
No. Adult for stem cells is when they are 7 days old.
Wow.
Now, after 7 days, what happened? Those stem cells will create 3 important tissue of the body. It's called mesoderm, endoderm, and ectoderm. Now, from these 3 tissue, stem cells will be able to work and to grow and to differentiate in different cells, but only within their own tissue. So with these cells, you cannot clone anybody. You can just do some cells. Now, after 9 months, your body is ready. Your embryonic stem cells have done their job. They have created a life. Now it's time to repair, to regenerate, to maintain. And that is the target of the adult stem cells. This is why basically we're using all kinds of adult stem cells to treat, repair, maintain, regenerate, but we are not using embryonic stem cells because it's too dangerous, only for treating some genetic defect. There's 3 major benefits we saw. The first one is duplication. The second one is becoming any kind of stem cells. But the most important is that they release some very specific molecules called growth factors. Now, these molecules are responsible for regenerating, for maintaining, for repair, for all that. Now, all depend on the stem cells that you are using. One will have more duplication, one will have more differentiation, and one will have more growth factors. And that is the genius of every researcher or practitioner who know exactly what kind of stem cells, of adult stem cells to use for your personal case. This is why stem cells basically is a personalized medicine.
Wow, William, this was so informative. Thank you so much for sharing with us.
You're very welcome. Hope to see you again in Costa Rica. Look at the sky.
Yes.
Blue sky in Europe is -10. Here is +28.
Come back to Costa Rica.
Thank you very much. My name is William Amzalag, and I am a French medical doctor. I am today 78 years old, and I have been diagnosed with rheumatoid arthritis about 38 years ago. I took almost everything: cortisol, biodrugs, Humira, methotrexate, name it. For 38 years, I got those products. My pain was decreasing, but my degenerative diseases will continue for a long time. February 2019, I go to visit my friend Dr. Giampapa in Costa Rica, and he injected me a 40 million unit of umbilical cord, plus he took some stem cells from the adipose tissue and injected it in my ankle, which was the most important part of the degenerative diseases. I have to say that I have been immediately released, not totally, but very, very good progress. But my first and fantastic thing is I stopped all my medication from this day. And as today, I didn't take any medication, using only stem cells. In May, I come back again and I did 200 million expanded stem cells from umbilical cord, plus some PRP in my joint, in my ankles and my wrist. I have today to say that I'm profoundly relieved from pain, no drug anymore, and I intend to do it on a yearly basis. Thank you.
What a delightful guy Dr. William Anzalog is, and I really appreciate him sharing his story for Pain Revealed. And also want to say thank you to Keziah for getting this interview done for us. This interview with Dr. Paul Winterton was quite a surprise to me. I never thought I would hear a conventional medical doctor talk about the use of essential oils in pain management, and that's exactly what he does, so enjoy this. Paul, thanks so much for sitting down and having this conversation with us. Tell us about your background.
Grew up in the great Rocky Mountains, and with that had a lot of early exposure to injuries, broken bones, ligament injuries, and early on had significant interest in anatomy. Went to college here at the University of Utah and became very interested in moving ahead with medical school. I completed my medical training in Boston, did my orthopedic training in Minnesota, did a few fellowships in foot and ankle reconstruction and shoulder and knee reconstruction, and have landed here in the great Rocky Mountains again to practice orthopedic surgery.
There's some prestigious institutions in Boston. Where'd you go?
At Harvard Medical School.
Why settle for less?
Well, they wanted a nice conservative guy from the out west to kind of counterbalance some of the less than conservative traditions there. So,
well, good. I'm sure you represented well.
yeah.
So, and how long have you been practicing orthopedics now?
I'm on my 22nd year.
Do you consider yourself traditional, non-traditional, a hybrid? How would you characterize yourself?
I'd probably be a loyal hybrid. I am very dedicated. As an orthopedic surgeon, I'm beholden to the American Academy of Orthopedic Surgery, the American Board of Orthopedic Surgery. I was on their board of counselors for 6 years. Where I towed the line and was part of their political advocacy to make sure that orthopedic surgeons are making orthopedic decisions rather than plumbers and lawyers in Washington, D.C.
And almost literally, right? I mean, trying to determine what kind of health care should be provided, is coming from non-experts.
Yes.
Which could be a pretty frustrating situation for someone like yourself who's spent an enormous amount of time getting educated and has a lot of experience. So how do you navigate that, in today's world where you're saying, I know what's best for my patient, yet I feel like I have restraints put on me, and you got these people who are obviously in a lot of pain, discomfort, injured, what have you. So how do you make it all work?
You get right down to the brass tacks. You open your door. Mm-hmm. You see anyone and everyone in your clinic, regardless of their capacity to pay. Mm-hmm. You establish relationships in the community with primary care, where you're known in the community to see everyone and anyone, and it all works out at the end. You disregard any vertically integrated pressures to perform health care in any way that would compromise the care of the patient. You do what's right. Mm-hmm. You see the patient, you examine the patient, you sometimes treat the patient surgically, non-surgically, and you really engage the patient in their own care.
And your patients, in your specialty, very often are experiencing pretty significant or severe pain as part of what they're presenting with. And sometimes I imagine it might be chronic because it's just a long-term injury that's degenerated. Sometimes it's acute because they just broke a bone or something. So what is your approach or philosophy towards pain management?
So, of course, there's acute pain that happens when you fracture a bone or post-operatively. Mm-hmm. You've got mid-range pain, 2-3 weeks after surgery, still struggling, and then, of course, chronic pain syndrome, which is where you distinguish the disease, the fracture, the ligament injury to the illness, mm-hmm. the associated anxiety, sometimes despair and depression that comes along with pain. And those are the most difficult types of pain to manage. Chronic pain syndrome has to be dealt with in a multimodal fashion, not just throwing opiates or high-powered non-steroidal anti-inflammatory medication. You've got to manage it with a lot of attention to the patient's perceptions of pain. And there are a lot of different modalities, a lot of complementary. I don't like to call them alternative because the reality is you have to manage these patients in a multimodal fashion. And that's the philosophy. When they come into my clinic and they're struggling with chronic pain, I have a full-time massage therapist in my office, mostly focusing on either the site of where it hurts or doing hand, forearm, foot, and ankle massages with essential oils that have clinical efficacy regarding decreasing blood pressure, decreasing heart rate, decreasing anxiety.
That's unusual, right? Is that kind of the hybrid thing? I'm hearing a Harvard-trained orthopedic surgeon talk about having massage therapists with essential oils on site, and further citing clinical efficacy based on peer-reviewed research.
That's right, and it is all peer-reviewed. We're in a stage now where these particular aromatic compounds, essential oils, have been studied at length with human trials. And not only that, bench work in the lab where we know the receptors, we know the structural location of how they attach to receptors. You know, pain is mediated by mu and kappa pain receptors, and we know where those constituents of essential oils attach, how they can topically provide analgesia, how they can be inhaled and increase the serotonergic and dopaminergic effects of perception of pain in the brain. It all makes perfect sense, and people may still have pain and be able to describe and in their pain narrative what that pain is like, but they're much more indifferent to it, and sometimes with the euphoria that comes with some of the essential oils, they're able to manage that pain. Their perception of pain is considerably diminished.
So with this shown efficacy, it's published, as far as you're saying, hey, this isn't just kind of your own imagination where you assemble these things speculatively. You've got some real scientific data to support the use of things like essential oils in helping to support your patients with what they're going through. Why is it not ubiquitous in medical practice or orthopedic practice, at least?
Well, it may not be ubiquitous, but it certainly is becoming mainstream.
It is.
Oh yeah, you've got vertically integrated healthcare systems all around the world. And here in the United States, we have huge hospital systems where if you're not engaged in a very aggressive, not just present, but aggressive aromatherapy initiative, you're behind the times. It would be an embarrassment to have a hospital system that does not have that included in ICU care, in hospital floor care, in care of nurses. As a matter of fact, hospital personnel, there are programs for them, 12-hour shifts. They'll take a 15-minute break and be completely revitalized with inhalation and topical therapeutic modalities such as essential oil management to help. If you're not engaging that particular modality, you're behind the times. And that's not just based on touchy-feely, oh, it smells so good. Oh, do you smell that lovely citrus scent floating down the hospital hallway? No, we know exactly what's going on in the brain. We know what's going on at the analgesic centers of the skin, of the topical touch. And we have data that shows it, not only animal studies, but human studies.
Wow. So fortunately, I guess I haven't spent enough time in hospitals, so because I haven't seen it, and it's really encouraging to know that this is going on. And how does this tie in? Because you said something earlier that I think is important relative to pain. It's not just, hey, it's a physical phenomenon that we have to try to get control of and manage. There's a psychological dimension to this. And as you're describing, lowering blood pressure, lowering pulse rates, maybe decreasing anxiety, those are all sympathetic responses, right? Kind of fight-flight responses with pain. And that can create kind of this psychological loop that starts to play that it feeds on itself, I'd imagine. So at the same time, you're saying with some of these interventions in the way of essential oils or even massage therapy, somebody touching you in a loving way, that this sort of can have not only physical impact, but psychological impact.
Oh, those of us who use essential oils, we might try to avoid talking too much about that psychological aspect because we love the data and the science of where it attaches to that pain receptor, but there's no question. JACO, the hospital accreditation services, have now included pain as the 5th vital sign. You've got heart rate, you've got blood pressure, you've got respiratory rate, you've got mental status, and every patient must have a visual analog scale of where their particular pain is when they're admitted to the hospital. Not only to suggest that if they come in with an 8 out of 10 visual analog of pain, well, if you're going to be a responsible hospital or ICU, you're going to manage that as another vital sign. So how do you do that? Well, you don't want to give people only opiates or give them sedatives. If you have a way to decrease those vital signs, where they reach critical levels, with topical massage. And by the way, studies show that it's just not the warmth of the touch that decreases those heart rates and blood pressures. They've compared just plain massage with essential oils, and there's a clear pharmaceutical effect. So from the psychological standpoint, yes, chronic pain syndrome, by definition, is a psychological presentation where there's anxiety, despair, depression, negativity that's associated with that has a significant effect on the somatic aspects of one's function. And if you can manage those particular psychological symptoms with particular aromatic compounds that you breathe in, that go to the amygdala, that mediates that fight or flight. And if you can decrease those symptoms of anxiety, you've done a remarkable service for that patient and, frankly, for the institution that you're working for.
And amazingly, no adverse effects to using these compounds, right? And that's kind of like, unusual in the traditional medical model.
So regarding the adverse effects, yes, that's what draws people to these aromatic compounds. They don't have side effects. Now, that's not to say that if you put a powerfully acting clove on your gum line for a toothache, yeah, it's going to be analgesic and you're going to lose your toothache. That phenol in some of these essential oils can be quite powerful, cinnamon oil, these types of things. So you do have to be careful. So maybe topical irritant, which actually the counter-irritant effects are some of the analgesic effects. But for the most part, those that are being inhaled and entering your inner ear for motion hypersensitivity, entering your amygdala and other parts of your prefrontal cortex that mediate emotion. No, people are getting great relief without all the horrible side effects that come with traditional benzodiazepines or barbiturates or opiates. They have no side effects. And that's why vertically integrated systems are moving so aggressively toward this. There's very low risk. Now, yeah, if you wake up from the operating room and you get a little peppermint in your eye, that's going to burn and sting for a little bit. But the antiemetic, anti-nausea effects of peppermint and ginger and cardamom and spearmint and fennel, anise, coriander, caraway, peppermint and ginger, all of that is dramatically worth any mild side effects that you have.
Now, when you were, let's say, a resident or even in medical school, and someone back then said to you, oh, there's this future in aromatics, that are going to be used in medicine, would you have thought them somewhat crazy?
Well, it depends on where you train. Now, I trained in the sensitive Northeast United States, where we were quite forward-thinking in these types of things. But even back then in the 90s, that was fairly radical thinking. And back then it was, you get together in prayer circles and pray for the patient. That was even more radical. Now, that's standard of care. I mean, we clearly have data that unequivocally shows the efficacy of all of these modalities. So like I said, they might be seen as somewhat unorthodox, no more. It's just a matter of whether you're willing as an institution or a physician to catch up.
So I'm smirking here a bit because I'm sitting across from a Harvard-trained medical doctor who's an orthopedic surgeon talking about prayer circles and essential oils and as a contemporary part of treatment protocol. I think now I've seen it all. This is great.
Yeah.
So dealing with pain specifically now and looking at the varying modalities available to you, opiates, obviously big conversation right now. A lot of people who have had pain, have been prescribed opiates. We all, I think, are very aware of the epidemic and the addiction and a lot of the trouble that creates. How do you see all this right now, and has it changed your behaviors at all as far as your prescribing patterns?
Not only subtle, dramatic.
Okay.
We now have the DEA watching us with a magnifying glass. We physicians are responsible for the majority of addictions to prescription, at least prescription opiates. Heaven knows how many patients I personally have out there, how many of my colleagues here in the Intermountain West, how many nationally are responsible not only for addiction, but all of the side effects of addiction, suicide, divorce. But the definition of addiction is when one's gainful employment or relationships are dramatically altered because of their dependence on a certain behavior. So what has happened to us? Well, what was routinely prescribed, 40 to 50 Percocet pills for perioperative pain management, we're now restricted to 25 tablets, which some of us still thinks are too much. And if we prescribe more than that, we'll get a call from the pharmacist saying, you've exceeded this. Your patient has an insurance company that won't provide that, which is great. As far as our continuing medical education, we're offered a significant, generous number of hours of continuing medical education to really sit down and study the data on opiate addiction, on perioperative pain management, on chronic pain management, and ways to dramatically diminish the amount of opiates. As a matter of fact, I was just operating at a hospital today and walking down the hallway, and there were about 100 pictures of what an opiate pill looks like, to remind us as we walk down the hallway as physicians that we have a choice to potentially harm patients with those pills or consider alternatives. So
there's a cultural shift, even in the environments where you work.
Dramatic cultural shift, all within the last few years, and it's 2019, within the last 2 years especially.
Wow. So for people that are maybe facing varying types of pain issues, and maybe they are on opiates, maybe they're running to the end of their opiate prescription, what are their alternatives? What else can they do to try to deal with their pain?
What you've got to be really careful weaning people from this, because as people take opiates, the receptors that attach to those opiates recede into the cells, so you need more and more. You develop a tolerance.
Right.
So you have to wean from them to allow those receptors to come back. And then you look for alternative sources to alter their perception of the pain while you wean from those opiates. And so you move aggressively toward multimodal approaches to pain management. Foremost is weaning from the opiates. Secondly, probably nutritional issues and those types of nutritional habits that are profoundly inflammatory.
Can you speak to some of those?
Yeah, so we know now unequivocally that center aisle grocery store stuff that we've all been fed for the last 30, 40 years in the American culture, the Western culture, foods high with refined carbohydrates, that when they go through your pie hole, they're immediately turned into fats and inflammatory substrates that cause a lot of pain. Foods high in high fructose corn syrup, and of course all the sugars that we eat. Interestingly, we were all raised in a culture where saturated fats were declared as the source of all of our heart disease, where we know now that diets high in healthy saturated fats have a dramatic anti-inflammatory effect, increased mental acuity, increased capacity to manage pain, and so nutritional choices. And I could go down the whole list of things to cook with.
Well, just what's of interest here, and I might ask you about some of that, but there's a relationship then, what you're saying, between inflammation and pain. And can you speak to that?
Yes. So what types of pain do we have? Well, there's pain mediated from an injury, where you cut the skin and all of a sudden potassium and sodium channels start going crazy. The mu and kappa receptors start sending signals to your spine. Ouch, that hurts. You have those signals being sent either through glutamic acid, type A fibers, or peptide substance P, all of those mediators from an acute injury. So then we have other sources of pain like myalgias or arthralgias. And of course, the main source of arthralgias, meaning pain in the joints, is inflammation. Right. Inflammation is a process where there's increased blood flow to a particular part of the body, and that part of the body starts making inflammatory mediators. And inflammation is painful. And there are particular prescription medicines that can manage inflammation. We're all acquainted with over-the-counter, ibuprofen. The natural sources of anti-inflammatories, willow bark is where aspirin was elucidated from. Salicin or salicylic acid. Hippocrates used crushed willow bark. So all of these essential oils that we've used, they really got their start in pain management, particularly with anti-inflammatory mediators. The champion, helichrysum, it comes out of the Balkans, where this particular plant, when turned into aromatic compound, attacks all 4 catalysts of the inflammatory cascade.
And what's that plant?
Helichrysum.
Helichrysum, okay.
But it's very expensive. But there are also other anti-inflammatory, frankincense, myrrh, very biblical.
Biblical, I was going to say, yeah.
And there's a reason why that stuff was magical, because it has profound pharmacologic activity. And this isn't just hand waving. We not only know that the whole oil is inflammatory, we know synergistically multiple constituents in those oils act in tandem at that point of inflammation, usually peripherally for somatic inflammatory processes like the arthritides. And those can significantly affect pain management and perception of pain. But not only perception, it actually stops the inflammatory process or dramatically inhibits the catalysts that mediate inflammation.
So theoretically, let's say that we have 3 patients that have identical injuries or causes of their pain. Maybe 3 post-surgical patients, or 3 arthritic patients, what have you. If they, and again, theoretically, let's say they're triplets, okay, so they're genetically identical, but their lifestyle, as far as what they're eating, what they're thinking, how they're behaving, they're going to have 3 different experiences of pain or amplitudes of pain based on that. Perceptions
of pain.
Yeah.
That's right. And however they want to move ahead, and however you, as perhaps a treating physician or a colleague, want to work with them. Aromatherapy, I don't like that term because people think, aroma, smells nice, it's pleasant. Right. That's why it works, because it smells good. Right. Well, the actual pleasant scent that comes with aromatic compounds is what attracts people to them. Right. Those constituents that give it a nice aroma aren't really the pharmaceutically active constituents. It's just the way Mother Nature has drawn people to them.
Kind of the Trojan horse, right? We're going to sneak it in this way.
Great analogy, Trojan horse theory. And so the 3 ways that we can get aromatic compounds into our system, you can inhale them. Right. And just like if you take a hit of a good marijuana joint or a cigarette, you're delivering those pharmaceutically active compounds of THC or nicotine. Similarly, if you inhale essential oils, they go to your prefrontal cortex. They go to your amygdala. They go to your lungs and are immediately distributed peripherally. You can topically apply essential oils, which is perhaps one of the most effective ways. And we know that the skin has absorptive capacity to deliver systemically essential oils that are delivered topically. And of course, there's the analgesic effects, local effects. If you have arthritis and you apply a pharmaceutically active essential oil to a joint, it goes through the skin, the dermis, subcutaneous tissue, goes through the capsule and goes into the joint. Our orthopedic colleagues in Germany have done studies where they'll, in a dose-dependent fashion, will apply particular anti-inflammatory medications, and then we'll go in arthroscopically, take a biopsy of that tissue, and prove that once applied topically, it's absorbed and goes in. So we have access that way.
Wow.
Now, Americans are also thought of as cowboys when it comes to aromatherapy. The French have been doing it for a long time. The English stay away from oral ingestion. But that's a great way to deliver. We now have essential oils that are delivered through ingestion in sustained released capsules. All of my patients postoperatively get a gel tab that has fennel, anise, coriander, caraway, peppermint, and ginger, all of which dramatically decreases the smooth muscle activity of the bowels postoperatively as far as postoperative bowel dysmotility. It's so frustrating.
Yeah.
All of my patients get that. And they always come back and say, what was that gel tab? Because, oh, it's the first time I've ever really had a really comfortable stomach after. So there's a lot of ways to manage patients within a formal hospital setting. And the great thing is you can get away from the medical executive committee restrictions most of the time because these are non-FDA approved.
Right.
They're not...
They're unregulated.
They're unregulated. You can't put a patent on Mother Nature.
Right.
Now, you can take a constituent,
Right.
farnesol, an antimicrobial constituent of lemongrass, and you can do certain things to it and then get a patent on that.
Right.
But as a physician, I just give that to the patients in the preoperative holding area. All of my patients preoperatively get aromatherapy where they breathe peppermint, ginger, spearmint, and cardamom to help with perioperative nausea.
Wow.
And
you're seeing that has efficacy.
Oh, well, I'm just following the lead of some of our greatest medical journals. The Journal of Anesthesia and Analgesia in 2012 published a cohort of 400 patients that were treated at the University of North Carolina that demonstrated a marked diminished postoperative necessity for pain management, less postoperative fentanyl, less intraoperative morphine necessary, less postoperative Zofran, and Phenergan. So I'm just kind of following the lead of my colleagues.
It's stunning. I mean, it's really kind of stunning stuff. I'm wondering, and this would probably be speculation, but if you look at we talk about smell, that's the olfactory nerve, right? So that's the very first cranial nerve, right? So it's like, so there's got to be some deep set neurobiological aspect to this, right?
Yeah.
And that say, hey, through these smells, our compounds come in, they have all these really beneficial effects, and it's interesting that it happens to be that particular mechanism to get it into your nervous system.
Well, if you'll just indulge me a little neuroanatomy. Sure. So you have at the top of your nasal cavity a thing called the cribriform plate, through which the little nerves come down that are attached to the olfactory nerve. That olfactory nerve has immediate access to the hippocampus and amygdala, are sites of memory and pleasure. And so those essential oil chemicals are immediately translated into neurochemistry and pharmaceutical activity. And of course, that immediately has access to the inner ear for some of the motion hypersensitivity, perioperative problems. And so it's not just, it smells good and elicits pleasant memories. It's tickling nerves that are affecting your neurochemistry immediately, particularly serotonin, which is our kind of indifference chemical. It gives you this, I could rate that pain 5 out of 10, but I'm just indifferent to it. It's much less. My perception of pain is dramatically diminished. And then, of course, dopaminergic, the euphoric neurochemical. All of those studies have been done where you inhale and then you check the titers of those particular neurochemicals, or you do PET scans. And the effects it has, you can do PET scans on the amygdala and see the effects of essential oils on the vascular activity after you inhale. Dramatically changes. That's neurochemistry.
Right.
That's not touchy-feely, oh, that's such a nice smell. Oh, thank you, doctor.
Which in and of itself wouldn't be a bad thing necessarily, but wow, you're really talking about some fairly robust human trials And it's not only that you're saying, hey, there's no known method of action here, but it seems to work. I mean, they're literally tracing it right through and understand exactly why it's working. It's explanatory.
Yes. As a matter of fact, we've become so sophisticated, we now have labs internationally that are doing the nanotechnology. We can actually make models of constituents of aromatic compounds, how they fold and twist and turn, and where they attach on receptors for pain, receptors for oncologic activity, that's cancer,
Right.
Where they exactly attach on that cyclooxygenase 2 catalyst for inflammation, to where we just don't kind of, that whole essential oil might have some type of anti-inflammatory activity. No, we actually can formulate the shape of that chemical. We can actually see how it folds and where it attaches.
Wow.
So that stereochemistry is now routine bench work that's being done.
Well, exciting times with all this happening. You were mentioning earlier a prescription that you wrote today. What was that about?
Oh, well, it was just a prescription for Percocet. So I go to the patient who just had a big ankle procedure, and I said, okay, so your homegoing medications are Percocet for pain, Phenergan for nausea, Valium for anxiety, Ambien for sleep assistance, and here's an antibiotic. And she looked at me and said, last time we talked, you did help with nausea with peppermint and ginger. Oh yeah, here's some of that. I give her a little spritzer. And then she asked, and what are some of my alternatives as far as perioperative pain management, where I might be able to take less Percocet? So patients are coming in demanding this, not just, gee, what are some good ideas? And so I wrote her a prescription for ibuprofen 800s, which is a non-steroidal anti-inflammatory. And then I told her the multiple type of essential oils that she could start applying that are also anti-inflammatory, that don't have the same side effects as 800 milligrams of ibuprofen, that does have a certain association with upper GI bleeds. So patients are very reluctant. They are coming in very astute and aware of the risks associated with opiates. And as a physician, if you don't have alternatives, you're really falling short in their eyes. The number one complaint that patients have with clinical experiences is anonymity. The dehumanizing effect of walking to a clinic and immediately being treated like a number. Go sit there. You're no longer Mrs. Johnson. You're number 3, and we'll call you into the room when you're ready.
Right.
If, just like someone going into Build-A-Bear, you can go to Walmart and buy a $5 teddy bear, or you can go to Build-A-Bear and have an experience and pay $60 for that Build-A-Bear.
Right.
Well, as a patient, if you go into a clinic, and from the moment you enter that clinic to the time you leave, you have been attended to. If you have the perception that you have been treated by someone who knows who you are, that cares about your comfort, that cares about not only the pain you have, but your perception of pain, and from the moment you walk into that center, if you're watching a beautiful National Geographic natural show, you then go into the clinic and you get a hand and foot massage with pharmaceutically active essential oils. That's even before the orthopedic surgeon has come in and says, I'm going to really cause a lot of pain with this knee replacement that I'm doing. The patient perceives that they are being attended to, that they're being treated as humans, not as objects to make your next boat or car payment, and they leave. Yes, it's good medicine. You've provided help with their anxiety. They've left. In fact, some of my patients leave after their aromatic therapy where I need to give them some rosemary or peppermint because they might fall asleep at the wheel. So you do have to be careful with some of this stuff. But they feel attended to. But the reality is, good medicine is medicine that attends to the patient's every sense of relationship. And frankly, the sacrosanct relationship between the patient and doctor, or doctor-patient, traditionally mentioned, is really an assault because healthcare has turned us into machines that crank patients through clinic.
That run algorithms.
There you go.
Yeah, and that is dehumanizing in and of itself, because if my job and regulated to do this job is to run an algorithm, then I'm already starting out where you're dehumanized and I just have a protocol, I become a technician not
Yes.
really a doctor or healer. And
That's it.
And I think, yeah, so what you're describing now is multisensory. It's more vitalistic in nature as compared to, mechanizing a process for everybody and running them through it.
That's right.
What's interesting I find also is that I know for myself, when going back maybe some years ago with varying sports injuries or an appendectomy, when I started to question for alternatives, that was an affront to the doctors who were I'd say, well, is there some other way I can do this, or do you have an alternative recommendation of me taking these particular medications? And they'd be very upset, but the fact that I was questioning their, what they were prescribing. With an appendectomy, I remember that I'm literally in the emergency room, and it's very painful, but they came in, they said, well, you're in a lot of pain, you're kind of squirming, let me give you, and they wanted to give me an opiate, a strong pain medication. And I said, no, I can tolerate the pain. And they're like, well, no, but why should you have to sit here? I'm like, well, because if something shifts or changes, maybe I want to feel it and know it, so I can, communicate it to the surgeon.
Yeah.
And literally the nurse looks at me and yells, why do you have to be so stoic? Like, it was an affront to her that I wanted to stay in pain and not take these medications.
Yeah.
So what you're describing is almost like a new paradigm, as far as how this would work, that you celebrate a patient who comes in and said, I'd like to think of some other alternatives that maybe you can recommend. And thank goodness you're prepared to answer that question.
Yeah, you really have to start seeing the patient from the moment they walk in, not as a car engine, and that you're not a garage. And it's just plain good medicine. If someone comes in and there's a surgical solution to their problem, there's always the funny joke that we surgeons use, the chance to cut is the chance to cure. Well, severity and duration of symptoms is what drives us with the best care for patients. Find out how bad something is, the severity, how limiting it is functionally.
Right.
Always asking the question, what are the things you'd like to do but can't because of this problem? Right. How is this affecting your relationships? How is this affecting your gainful employment, which one's financial health is directly related to their emotional and physical health. Right. If you're not really tied into those types of things and really figuring out the modalities that best serve that patient, a good dose of fentanyl is going to make someone feel really good, but can they go back and function as an employee? No.
Or a parent or a spouse, yeah.
Exactly. And heaven knows that the wake that healthcare has left, the damage that we do with some of our modalities with the most critical institutions that people deal with day in and day out. They leave your office. They're only there for 10, 15 minutes. Yeah. But the things we do to them or for them has a significant effect on their life.
Well, it's interesting, isn't it? Because you have the ability in your office to either make that the best part of the person's day or the worst part of the person's day, right? It's not usually in between. It was either, oh my God, it was a horrible experience. I waited for 2 hours. They didn't even know who I was, whatever. Or, my goodness, I got, somebody, massaged me while I was there. I smelled, these great essential oils. I had a doctor who came out and actually knew my name and cared about me. That's the opportunity behind, that every doctor, that is treating has the opportunity to steer her.
Yes.
So it sounds like you chose, what I would call the high road.
Cross-culturally too, it's a very frustrating thing to have someone come into your office that speaks a different language. In our particular community, a lot of Spanish-speaking patients. And of course, those language barriers, those cultural barriers are profound. Completely different approach. Someone comes from a country that really doesn't have a lot of resources. They see hospitals as places where you go to die. Right. And this white coat I'm wearing means that I might die. And so using modalities and clinics to make that, many times those patients come in with, pardon the expression, 8th grade educations. And some guy is across the room talking to them about how you're going to go in and replace a ligament in their knee. No way. But you gain access to their trust and you give them confidence that they're moving in a direction that will improve their life through these other modalities as well.
There's a great volume of people suffering from chronic pain. and they can buy Advil by the bucket, but over time that's going to have some adverse impact on their organs, their liver, their kidneys, et cetera, or Tylenol, what have you. Temporary solution, but not maybe long term. So for somebody who's been suffering from chronic pain and has those psychological effects, it can make you angry, it can make you depressed, it can make you irritable, all those types of things. Do you have any advice of things that they might consider that they're not thinking about right now?
Yes, so I think the question is, and this is what's frustrating as physicians, people will come and say, my mother-in-law has multiple sclerosis. Do you have an oil that treats multiple sclerosis? Or I have someone that's really struggling with rotator cuff pain. Is there a specific oil that treats rotator cuff? And those types of questions are really riddled with real issues because, no, things are not that specific. Mm-hmm. And as far as protocols, the protocols are available. Mm-hmm. And there's huge resources of bibliographies. But the problem is if you sit down and go to PubMed and say, rotator cuff tear essential oils, you're going to get frustrated. Mm-hmm. What I've often provided for my less scientifically astute patients, as well as my most astute PhDs that want to come in and get a laminated bibliography of why I'm putting that frankincense and bergamot on their painful wrist.
Right.
They want to see the data. So in 2015, probably what I would call her is the godmother of aromatherapy in the United States. She's actually from the United Kingdom. Mm-hmm. Jane Buckle, she's got a PhD, and as a lot of aromatherapy specialists start their experience, she's an RN. Mm-hmm. And she has put together probably the most responsible organ systems-based, symptoms-based collections of protocols and particular combinations of essential oils for different types of maladies.
Mm. This is in a book? It's compiled in a book?
It's in a book. It's called Clinical Aromatherapy. Mm-hmm. And it's to what I refer most of my patients. Mm-hmm. It's $80 on Amazon. I've referred it so much. And she's kind of retired and living in the UK. Hello, Dr. Buckle. I hope she's still really publishing because the book is very responsible, mm-hmm. very scientific, mm-hmm. very clinically oriented. And it goes all the way from, I fell and scraped my elbow. What's a good topical antimicrobial? To, I was just diagnosed with multiple myeloma. And my goodness, this chemotherapy is just destroying my life. What can I do? Mm. And every section of that particular book, which is, again, symptoms-based, mm-hmm. it has a whole section on immune process, on inflammatory process, pain and inflammation, which was today's topic.
Right.
But also a whole section on palliative care for cancer centers. Mm. And not only that, but most responsibly at the end of each chapter has a bibliography which is just like touchdown. Yeah. Because guys that are beholden to allopathic medicine and to boards, we can just kick back and say, okay, well, here's the study. Mm-hmm. It's a human trial. Yeah. And next.
Yeah, exactly.
And so, and of course, there are some other distributors of essential oils. I've become very intimately acquainted with an organization that spends a lot of time focusing on the quality of essential oils, and that's probably something that shouldn't go without mentioning in this particular forum.
Sure.
An essential oil in Southern California is different than an essential oil in Southern France. Right. For example, the pharmaceutical efficacy of a particular aromatic compound depends on the elevation where it's harvested, how it's distilled, the temperature where it grew. Mm-hmm. And so there are particular distributorships of essential oils that are very responsible with their analysis of particular constituent concentrations, where they get their frankincense, whether it's Moroccan or Somalian, and I've really become sensitive to the particular essential oils that I choose to use with my patients. There's a distributorship called doTERRA, that DOTERRA, that I've been very, very happy with, not only the efficacy that my patients enjoy, but I know particularly where the oils come from. I know their gas chromatographic studies, their mass spectroscopy. I know that the oils that I'm using, the bottles even come with little barcodes where you can actually go and show that barcode, and up on the computer screen will come the particular mass spectroscopy fingerprint of that particular sample of oil that you're holding in your hand.
Wow.
And you can look at that 1,8 cineol that's a powerful local analgesic. And you can look at that lavender sample with linalool and linalool, both of which are profound anti-inflammatories. And you can kind of see the oils that you use. So that might help people. It's tempting to go down the list and say, oh, okay, well, when someone comes in and is really struggling with perioperative nausea, this is what I use. What do you do to prevent deep periprosthetic infection after a total joint? Well, there are all sorts of essential oils that will dramatically decrease the chance of deep periprosthetic infection postoperatively.
So, no matter what your concern is, you've got a resource now to go look it up.
Yes.
And not all essential oils are equal. No, just because somebody says frankincense is good for this, it's like it's a qualitative issue. And that matters a lot. Because I imagine there's many people maybe who got, for lack of a better term, cheap products, and they said, oh, that didn't work for me, but they really never got the opportunity to see a quality product work.
Yeah, it's a devastating part of the industry, but it's something that we can't regulate. A great example is a very expensive type of oil that is very efficacious for viral cold sores, Melissa oil. Well, you can make a bottle that you say is Melissa oil. It smells just like it, tastes just like it, feels the same like it, but it could be just lemongrass with a little extra adulterant that makes it smell like Melissa oil. That's one example, and there are very unscrupulous companies out there, and they'll go unnamed, that do that kind of stuff and sell a $120 bottle of Melissa oil that's really a $15 bottle of lemongrass.
Wow, and a lot of people would think that, oh, well, since it's expensive, it must be a higher quality product, and that's not necessarily true.
There you go. And so, as far as quality assurance, you really have to focus on that, and that's why I've been very, very selective. There's another great website called aromascience.com where you can look up a particular symptom, you can look up a particular organ system, you can look up a particular oil of what it's traditionally used for, and they are very well spelled out as far as antimicrobial, anti-inflammatory, analgesic, and it just goes down the list.
Yeah.
We have 3 different types of pain. We've got somatic pain, which tend to be sharp, stabbing pain, very well localized extremity type of pain. We have visceral type of pain, which is kind of organs-based, which are very dull, very non-specific. We have neuropathic pain, which often are associated with chronic pain, which are very poorly localized, radiating. As a matter of fact, that's most helpful for aromatic compounds to be used for topical massage because they can change the trajectory, not only the severity trajectory, but the virtual trajectory of referred pain. A lot of neuropathic pain that comes from the lower back, radiating down the leg. It's so non-specific. People just say, if I could just have that lumbar spine cut out of me. And so those types of pain, somatic, neuropathic, and visceral, all have different ways to be treated with different patterns, inhalation, topical, or ingestion. The typical symptoms that you hear talked about a lot are headache. Essential oils have a significant influence on multimodal management of migraine headaches. You've got bowel dysmotility. Of course, you've got topical analgesic pain, the arthritides that we talked about. So it's a great modality, and it's not only the only complementary modality, but I've been very impressed with its effects personally with my patients.
Before we started the interview, you were mentioning something that's become a very popular oil, at least at doTERRA, and it's
Copaiba, and it's been a fairly sensitive topic because we know that there are different strains, different genders of particular hemp. There's the female hemp that has, of course, the extreme pharmaceutically active THC. You have the profoundly anti-inflammatory male hemp, and then you have different types of essential oils, different ways to distill. One of the great successes we've enjoyed, I just finished a cohort of patients in my office where I interviewed 50 patients with hand inflammation. And I use inflammation very specifically. And of course, there are different causes of hand inflammation. You can have rheumatoid arthritis. You can have osteoarthritis. You can have degenerative arthritis. But I saw 50 of them. I did x-rays on all of them. I had a formal diagnosis. And then we did formal studies of Copaiba oil, which is a hemp-based anti-inflammatory essential oil. And then we checked the angular capacity for flexion, grip strength, pre and post, not only massage, but distinguished massage and massage plus the oil, and had statistically significant data come out of that study.
Wow.
That's unequivocal.
Right.
I won't go into the science of what it means to be statistically significant, but what it tells you is the chances of that particular outcome following that modality, of it just being a random chance you get those outcomes, are near nil.
And so basically this oil is rich in what substances that give it this effect? Or what category of substances, what's in here that make it do what it does?
Anti-inflammatory. We know the molecular structure of those constituents. And again, the problem with going through and saying, yes, this particular 1,8-cineol or linalool as an anti-inflammatory, Merck gets a hold of that and says, oh, well, then let's take that myrcene and linalool and let's reproduce it, add a nitrous group to this, add a carboxyl group, and we'll make it really potent. The problem is the efficacy of essential oils aren't based on single constituents. It's multiple constituents working at different
together,
sites.
and that's why just isolating them and trying to turn them into pharmaceuticals is not not the same thing.
But I'm a regular consumer of oral-based Copaiba. If I'm feeling a little achy after a long day in the operating room, I'll come home and take 2 gel tabs, and I'll get the same effect as 800 milligram ibuprofen.
Wow.
Or sedatives. It's really popular to take sleepers these days. Ambien, no longer because it's so powerful. There are new oral preparations of lavender. We've all known that lavender has effects on insomnia, but there are lavender with thiamine preparations now that are wonderful, where you just kind of get a nice, gentle mellow, where if your child starts crying, you can still wake up and still be responsive. So there's some great preparations now, multimodal preparations of essential oils that just aren't buy a bottle and smell it, topically apply it, all different ways to.
And you said this almost offhandedly, but when you're doing, would you say it was lavender instead of Ambien?
Yeah.
With lavender, like you said, if you wake up, you're not dysfunctional. So yet it still has the you have the upside without the downside.
Right. All the side effects, and if what you're after is I want to be schnockered and I want to do the Michael Jackson propofol treatment of anesthetic to go to sleep. I mean, no disrespect or irreverence, but that's what was going on there.
Yeah.
That's not how we manage insomnia. We manage it with multimodalities, sitting down, relaxing, a little bit of exercise before sleep, and meditate. Be mindfully present, and a little bit of lavender inhalation or preparation. You can really manage things nicely without all of the side effects.
Right, because incidentally, one of the byproducts of chronic pain is insomnia, right?
Yeah.
I mean, people have a hard time sleeping who are experiencing pain. It just, they go hand in hand. And isn't that the slippery slope? Because, well, I'm taking this pain medication, but I'm having a hard time sleeping. Now I'm taking Ambien. Yeah. Next thing you know, you're taking all these drugs. And with these types of alternatives, that are useful to the body without adverse effects, it just seems like it makes a whole lot more sense.
Patrick, you just said alternatives, and I would venture to say that we moved beyond it as an alternative option, and now I would declare it as standard of care and complementary.
Yes. To me, again, it was my dream to see this type of a standard of care, right? Where, maybe drugs are more a last resort than a first line, right? Pharmaceuticals at least, and that, there's these other ways to achieve things that are a lot more rational in nature. Yeah. So, but of course, the science has got to catch up, and there's got to be some validity to it, and it's a regulated industry. So, how can you make claims? Well, you have to have some published data to be able to make these claims. So I see it all coming together, but it's very, very exciting. So I guess maybe as a final sum up, in the world of pain and pain management, what do you think the next 10 years is going to yield? What's the future look like?
Certainly, it's going to be focused on diminishing the amount of opiates prescribed. Mm-hmm. It's going to focus on illicit opiates and how they destroy lives. Mm-hmm. But not only that, illicit opiates and how the solution to that is not going to be incarceration. Mm-hmm. It's going to be ways to create an environment where people can find complementary options to manage their pain. It has to go that way. Yeah. There's far too great of a cost in society. We have 100 million Americans struggling with not only chronic pain syndrome, mm-hmm. associated increased heart rate, increased blood pressure, increased anxiety, depression, despair. 100 million. That's 1/3 of our population. Wow. Now, I'm not much of a Rahm Emanuel, let's not let a good crisis go to waste here. but the reality is, it is crisis level. Right. And necessity is the mother of invention. And so we, as physicians, and the populist body politic, has a choice to start really, really pursuing strongly alternatives or complements to pain management. Future of pain management, mm-hmm. you're going to see a lot more natural products with less side effects, enteric-coated preparations. Mm-hmm. You're going to see sustained release preparations. Mm-hmm. You're going to see nanotechnology coming into play, where we're learning exactly where in the body these particular natural products can be delivered, and particularly with regard to central nervous system pain management, much more specific, efficacious, natural products that find that mu and kappa and delta receptor for pain, just simply because pharmaceutical companies are kind of at their wits' end. Yeah. We came up with OxyContin, saying, it's going to be the great thing. It's sustained release. Well, people started crushing it and snorting it. Yeah. And it destroyed lives. Yeah. And so whether it will be mass production by very financially motivated pharmacopoeia, or whether it's going to be the body politic screaming, we need this, and particular distributorship companies that are going to yield to those demands. Mm-hmm. And that's happening right now, and that's been exciting, and that's why I've been so enthusiastic about affiliating with those distributorships, because my patients are demanding it.
Yeah. Well, this has been an extraordinarily stimulating conversation, so I appreciate you, sharing all the wisdom and experience you have, and give us a peek into what you see coming in the future. And I could tell you that I wish for myself and anybody I cared about, or anybody watching this, that they all can find doctors like you.
My privilege. Thank you.
Thank you. Well, for me, in my own healthcare philosophy, what a breath of fresh air. Don't over-medicate, and use natural things that people can bring into their life that can help manage their pain more effectively than toxic drugs. I felt this interview was pure gold. One of the most poignant aspects of the entire Pain Revealed journey was talking to patients. It's one thing to get the academic point of view, even the clinical point of view, but when you're talking to the people who are receiving these interventions and services, it's a whole new ballgame. So tune in on this and listen to what these actual patients had to say. Chris, thanks for taking the time to share your story.
Oh, I'm excited too.
So why are you excited to? Tell me, what was your experience?
Well, it was absolutely incredible. I got a postcard in the mail to go to a seminar. And one of my friends had been dinging on me about stem cell from Arizona. He's down there in the winter roping and stuff and had a bad knee and got injections and can ride again and everything. And so when I received the card, I thought it was from him, and so I better go to this seminar and see what they're talking about.
What was your problem that you felt like you needed help with?
Well, my story starts about 4 years ago. I had carpal tunnel surgery, and when I came home from that, I was sitting on my back porch enjoying the April 4th weather. Saw something out in the yard that I thought needed to be picked up. I walked out there and picked it up, and I couldn't get back up when I got down. And I kind of just fell over, and I didn't hurt myself or anything. But when I got up, I'm numb from here down, both arms, and drop foot in the right leg.
Wow.
And then I didn't know what was wrong. I thought for a minute maybe I had a stroke, Scared me to death. So I went to my regular doctor, and she said, well, you've inherited a bad back. I thought, well, that's okay. Dad had surgery in 1960. So I just waited, and she made an appointment with the neurosurgeon. I walked into the neurosurgeon on a Thursday and sat down, and he come in, and my MRI was up there, but he just looked at me and said, you're in critical condition. He said, I'd like to do you tomorrow.
Wow.
He said, C2 is being pinched off. That controls your diaphragm. He said, it quits, you quit. So Friday afternoon at 3 o'clock, we went in for a 5-hour surgery, and he did 5 layers of my neck.
Wow.
6 months later, he went in and did 7 layers from my tailbone up.
Wow. These were what, spinal fusions, or?
I have rods and screws, and
Wow.
I have pictures of them in my wallet so I can fly.
Wow.
Yeah.
Oh yeah, I guess you set off all the metal
Yeah.
detectors when you go
Yeah.
through the airport security.
I haven't been yet, so I don't know, but yeah.
So now you've had 2 surgeries, spinal surgeries, which are pretty intensive surgeries.
Oh.
What is your quality of life? Are you?
My quality of life sucks because I have no core. I have no core energy. You could come up and just poke me and I could tip over backwards.
Wow.
I fell down a lot. This leg, of course, has atrophied, so that was an issue also.
So after the surgeries, did your symptoms change, or?
No. I mean, I still had the drop foot.
And what about the numbness in the hands?
This continues to get better every day, but I asked 2 doctors and they said, oh yeah, that'll take a while.
So you already had the surgery. Now, how long after these surgeries you're still experiencing symptoms? How long after that do you get this postcard in the mail, as you called it?
Well, we have to tell you about going in a year after surgery and having him tell me I have 2 loose screws in a failed fusion. So we went in and did it again.
Oh my goodness.
And that was April of it'll be 2 years this year since that surgery. And my quality of life was pretty low. I mean, they just take the wind out of you, those back surgeries.
Yeah, I can imagine. So then you got a card for, saying that come to a seminar.
Yeah, so I thought it was from, this friend of ours, and so I just went. And when I went there, I knew I was supposed to be there. I'm quite religious, and that I felt like I was guided there. And everything they said made sense. And my husband and I got up and got a card and made an appointment. And everything else just fell into place as far as us coming up here and as far as us being able to afford it and have it done. It just fell into place.
So what did you have done exactly?
Well, when I came in, people here said I had quite a few things wrong with me. And rather than try to pinpoint one, they would just put it in my vein and let it go and do what it needed to do. And it was absolutely hilarious because the doctor who injected me started laughing. He said, your eyes are getting so blue. And they were blue until I come out here in the waiting room and stuff. And then they, went back to normal. But I took the injection, and that day, from that day forward, I did not have the debilitating pain that I had running down my right leg. I told the doctors, I said, it feels like you guys put a screw in my sciatic nerve. That's what it was like.
Before the cell therapy?
Yeah. And that's what we came to the self-therapy hoping to get rid of.
That was your main concern, was trying to get this debilitating pain handled going down your leg. And you felt some relief almost immediately?
Complete relief immediately.
Complete relief?
Overnight.
Literally, so...
Literally.
Wow. And
literally.
So what were your expectations? What did you think might happen?
Well, I really didn't have any, so that I still don't. I still think they're in there just doing their thing to me.
Mm-hmm. The cells?
Yeah.
So did you notice any other things change besides the leg?
Yeah.
Oh, yeah? Okay, so go ahead.
I went to the doctor after having the stem cell injection, regular checkup.
Mm-hmm.
She proceeded to take me off diabetic medication. I've not been on it since.
So back up for a second, because you and I didn't discuss this beforehand. I said, I'm going to sit and get your experience, so I'm having to slow down to make sure I'm catching all this.
Yeah.
So you came because you were having debilitating leg pain, but you also were diabetic.
Yeah.
How long were you diabetic?
Not very long. I'm going to say they diagnosed me maybe 5 years ago.
And so 5 years, and you're taking medication for 5 years?
Mm-hmm.
And did you have any thought in your mind about the diabetes when you were going for this therapy?
Not even thinking about it. But I was very well controlled, so I didn't think about it a lot. I mean, I took 1 pill of metformin a day, and that's a pretty low dose.
Right.
But I've been off them, and I've been back to the doctor 2 times, and I'm just holding steady. And
wow. All right, so your
looking
leg
good.
pain goes away. You're off your diabetic medication.
So then she wants me to go to the doctor because, even though I'm off the diabetic medication, I'm no longer a diabetic. She wants my eyesight checked.
Mm-hmm.
Well, I go to the eye doctor, and he kind of goes, wow. Because he looks at my eyes, and of course I have one eye that is damaged. I've torn the pupil in it.
Mm-hmm.
But he said he could show me 4 years ago I had a bleed in my left eye due to diabetes, and it's not there any longer. And I have improved eyesight. 65 years old, and the doctor says, you can see better than you did, 4 years ago.
Wow.
So that was another wow.
So this is, it gives me chills a little bit to look at you as you're having this experience, because you're smiling.
I'm thrilled.
I mean, to go from this horrible quality of life, as you described it, multiple surgeries and surgeries to fix the surgeries.
Yeah.
And I have to imagine it's depressing. I mean,
I didn't want to live. I mean, that sounds so ugly, but
no, it doesn't. I mean,
you
it's
just get so
understandable.
tired, and you get so tired of being sick or having to take pills to put up with the pain. And I just was pretty well had it. I know the pain must have had a drawn effect on my face, because after the stem cell injection, several people made notice of my face and how much more relaxed I was.
This is one of the things that we really want to highlight with Pain Revealed, because we talked to a lot of practitioners, different types of doctors with different points of view about how to solve people's problems with chronic pain, but sometimes you got to look at it through the lens of the patient. And that's a big part of it, because some people might think, well, pain is just something that's an annoyance, and yes, we want to figure out how to manage it. But you're starting to speak to a deeper issue, saying, when you're in the kind of pain I was in, you don't really want to live anymore.
Right.
But it also changes your appearance.
Oh, yeah.
I mean,
because I'm not...
The nature of the pain is that you have a certain appearance, and so people perceive you a certain way because you're struggling so. Because I'm looking at you now, and I'm seeing happiness. I'm seeing you have a brightness about you.
Yeah.
But that wasn't
Well,
the case
I want to
before.
play again.
You want to play again.
I didn't want to play for a while. I just wanted to drop out.
And so certainly you seemed like you had an ambition to want to get better, but at the same time it's like, this is not, there's no quality of life here.
Well, I couldn't find my core. I mean, I just...
When you say core, what do you mean?
That very inner piece of your body, right about here.
Yeah. Your spirit,
Yeah.
in essence.
And it was just, I had lost it. I didn't know I lost it. When they do surgery like that to you, they take your normal away from you, so you no longer, you're looking for normal. You don't even know what normal is anymore.
Yeah. Yeah.
But I feel, since I took the stem cell injection, that gathered my core. I really felt that way, that it gathered my core up. And of course, I'm continuing. I go to physical therapy twice a month, doing exercises, building my core, doing everything I can to help this keep going. I couldn't lift my leg. I can lift my leg now. Some of the other things that helped, I had eczema on one of my legs, and
That went away also?
yeah.
So eczema, eyesight,
Diabetes,
yeah,
and the pain.
The pain, which is what brought you in the first place.
Yeah.
So you're seeing a generalized impact.
And I just feel better.
Yeah. And for how others are experiencing you, what are they saying now that you've had this change?
Well, my girlfriend and I, we thought I was doing so good, we did a 101 trip from the tip of Oregon to San Luis Obispo.
Wow.
California coast, Oregon coast.
Wow.
We stayed in San Francisco 3 days. I mean, that's how it changed my life. I wouldn't even thought of going. And I mean, I went, and it was hard, but it was fun, and I went and did it.
As you said, you're playing again.
Yeah.
If you were to do a thought experiment and say, okay, what if that postcard never came? What if I didn't have this treatment? Now,
I
where do you
haven't
think
thought
you'd be?
about that, because that's a pretty sad thing.
Yeah.
It just makes me feel sad, because I think the pain was the worst.
Yeah.
I mean, when you get your body out of pain, then you can go ahead and look at life. But when you're just every day in pain, it's miserable.
And do you think about other people maybe who are suffering maybe in a similar way that haven't found this path?
Yes. I think it is a path of the future.
Yeah.
I think it will take over our medical practice as we know it. Because why wouldn't you put something in your body that would heal your own body?
Yeah.
I mean, it's amazing.
Wow. So, what do you think the future holds for you now? What do you think that you have ambitions that you wouldn't have had otherwise? And
I'm 65, and at 62, I thought I was done. I mean, I went into the Social Security office to draw Social Security. They said, well, you better put in for disability. And they never even batted an eye. I just got that, just poof, you know. So I was in a wheelchair. I had a halo on. It was not a good thing.
and here you are smiling.
At 65, when I celebrated my birthday, I said, I feel so much better at 65 than I did at 62. It's exciting that I can go and travel and live and be with my grandkids, run with my grandkids.
Now, and talk about travel. You had to travel a long way to get this treatment, right?
Yeah, just we live in Milton Freewater, which is about 12 miles south of Walla Walla, so it's about a 3 or 4 hour drive. I never thought about it if I didn't get that postcard. God sent me that postcard.
Good for you. So, Chris, one thing I want to understand, how much cell therapy did you get? Did you have to go through a series of treatments, or what did you do exactly?
No, when I came here, they just said that I had a lot of things wrong, and they didn't quite know where to inject it, so they just put it in my main vein. They said it'll go where it needs to go and do what it needs to do. And so I had one injection, and that was last April. It hasn't even been a year.
So it hasn't even been a year yet. We're like 10 months ago.
Yeah.
And in 10 months, you realized, and it was just one, and I'm not trying to sit here to sound like a commercial, but I'm really just trying to get the context right. You had one injection. It was systemic, just put into your vein through the body.
Two vials.
2 vials. And then 10 months later, this is it.
Here
huh?
we are.
Wow. Well, good for you.
I'm so excited. I'm excited to live.
So as far as the amount of pain you experience now, do you still have some pain?
I still have quite a bit of stiffness, and in the leg that has a drop foot, it wants to contract all the time. So I do muscle relaxers to keep it in control.
Yeah. But still more therapy for you to help, progress.
Yeah.
Yeah. So any summary thought? I'm seeing a very bright, smiling 65-year-old who's had a significant life change.
And I think that the stem cell injection was the life change. It changed my life.
Well, I certainly appreciate you sharing your story, and I wish you additional recovery and better health at 70.
Thank you. I'm looking forward to it.
Yeah, and thanks for being here with us and sharing that.
You betcha. Thank you.
Thank you. Are you in line for a restroom?
I am. I'm headed that way now before I take my trip home.
How long of a drive you have?
It's about an hour and 10
and a half,
minutes.
Yeah, okay.
Yeah, back to her house. That's one thing I forgot to mention.
What's that?
After all those back surgeries, my bladder, I had quite a bit of trouble with control of my bladder. And I think that's getting better.
Really?
And I attribute that to the stem cell too, yeah.
Were you on medication or anything for that?
They put me on Mirabetric for just a little while, but I'm off of it again, and I'm just going to see if it isn't better on its own. When I went to pick up the Mirabetric last time from the pharmacy, I have an annual deduction of like $300 and some odd dollars, or $410, I think. And I have to pay that before I can pick it up. That's a lot of money,
Oh, sure it is.
for a pill.
So did you decide to try without it, or what?
I did.
Really?
I want to see, I'm willing to do this stuff,
And are you seeing a difference yet?
Well, I haven't
had an accident.
Right. Yeah, and last time I was at your
I'm
house,
sorry, who's
how
this?
many accidents did I have?
A couple.
A couple, see.
And
So-
you haven't had one?
No.
And you haven't had the medication?
Right,
And you saved the money on the deductible?
so far. I'm
Wow.
sure they'll get me somehow.
I'm Patrick, who's this?
This is my sister, Becky Martin.
Becky, it's
nice to meet
a
you.
pleasure to meet you. This is interesting. So how are you experiencing your sister differently? I mean, we're having this impromptu conversation all the way here.
I
Go
think
ahead.
the one thing I saw
Yeah.
was that she hit a wall after all the surgeries and so much pain.
Uh-huh.
And I think it was so discouraging to her that she couldn't see her way to healing. And once she had the stem cell, with the pain gone, her attitude changed, and the little dot on the horizon became a big door up there.
Wow.
And she's getting ready to walk through it now.
And we'll talk about her walking through something. Are you seeing difference in her ability to move and walk? Or
Oh, yeah. She was
what was it
on her-
like before?
She was on her way to a wheelchair real soon.
Yeah.
And she's up walking and walking with less support every day.
Yeah, I'd like to throw these away, but
Yeah.
not yet.
Yeah, well, it sounds like you're moving in the right direction. And so what's it like for you to have your sister back?
It's great.
Yeah.
Yeah, because she's younger than I am, so I didn't want her going to pot. She may have to help me out later.
Wow. So you drove here?
No, she actually drove.
You actually drove? You just,
I'm not the snow driver.
You're here for company?
I'm just here for company.
Wow, what a good sister. Wait.
Pretty close.
Thanks for sharing those stories.
You bet.
All right, thank
I've
you.
been amazed at her progress.
Well, I was heading to the restroom myself, but ladies first. So, Bill, they said I have a live wire coming in before you showed up. So what's your story? You're here to talk about your experience, I guess, as a patient getting cell therapy. What caused you to want to get it in the first place?
I wanted to get it to save my career. I'm a fire captain with the city of Phoenix, and I hurt my shoulder years ago, and being the aggressive people that we are, we just let things go and figure, it'll get better, but it didn't get better.
Yeah.
It just kept getting worse, and it became bone on bone, and came down to time to have a reverse shoulder replacement, and that would have ended my career. And I was terrified of that because I still have a few good years left, I believe.
Yeah.
You may ask some other people, they may say no, but
How long ago was that?
I injured my shoulder in 2011.
So it's been like 7 or 8 years. And then at what point were you starting to consider surgery as the only option?
3 months ago.
Just 3 months ago.
Yes.
Wow. And what did it feel like, your shoulder? Like, in other words, was it just lack of motion? Was there pain associated with it?
All of the above. Lack of motion, extreme pain. I couldn't breathe in without having pain. I couldn't sleep at night. Putting my turnout coat on was miserable. Throwing my SCBA bottle over my head to go into a fire was crazy scary looking. Made it happen, but it was ugly to watch.
So what starts to happen, though, is if you have that kind of a limitation, then they start to say, well, you can't really perform your duties as a firefighter.
You can't perform your duties at all. We go through a thing called minimum company standards every year, and I got to tell you, I've been lucky to pass it this last 2 years because of the pain. And that's when I decided to go for shoulder surgery. But if you have a full replacement, you cannot lift over a certain, I think they told me 35 pounds, because it would snap the screws out of the shoulder girdle. And so that ends my career. Totally ends.
Wow. Yeah, because you have to be able to obviously lift a lot more than 35 pounds.
You have to be able to do a lot more with that shoulder.
Now, you look like you're otherwise very fit, and strong. So it was just that one joint that was the problem.
Right. And my muscles have atrophied on the left side. And so when I heard about stem cell,
How'd you hear about it?
my backseat firefighter's sister works here. And she has been wagging her finger at me for months. Come on down, come on down. And they're family. You know, Steve's my brother. And finally came down, and she explained everything. She had been giving me literature for almost 2 months.
So what was your resistance that you didn't want to do it till you finally said okay?
I had really no background on the stem cell process. And after I started researching it, and it seemed like magic to me, and I'm thinking, magic doesn't exist.
Yeah.
And it does.
Okay, so
it really does.
Now you're leading to the next question, and so then you came in, they explained it, and you said, okay, I'm in. Obviously, your benefits probably didn't cover this, so
No.
you have to invest out of pocket for it.
Correct.
But to save your career, it could be worth it, right?
Correct.
So what happened? They did the treatment, and kind of just walk me through that.
Came in, and first you need to know that these are the nicest people on the planet.
Awesome.
You walk in, and they make you feel absolutely welcome, takes any trepidation out of the process, and they explain exactly what they're going to do. And so I was kind of prepared for that. It's like having a cortisone shot in the joint. They numb you up a little bit and then stick the needle in, and then the needle actually, you don't even feel the needle going in, but you feel the fluid going in a little bit.
Right.
And I had raw bone that has been being ground down for years, and so there's a little discomfort. It wasn't bad at all.
Was there some prevailing wisdom? I imagine you're seeing an orthopedist. Did they think that this was, when the bone is ground down and worn the way it was in the joint, that he thought, there's nothing there to work with, so it wouldn't work? Or what was the?
That was the reason for them wanting the full reverse shoulder replacement, is because and honestly, prevailing wisdom says if you don't have bone and your rotator cuff is completely destroyed, you have nothing to work with, so you have to have surgery.
Did you tell them before the treatment that you were going to get stem cells?
Yes.
And what was their response?
He wants to know how it's working. Okay. Because they do the PRP thing that they inject, and that's the first step in any of their processes. So it's something that's becoming more and more mainstream.
So you had the injection.
Had the injection.
That was 3 months ago.
Yes, I did a series of 3 injections. I did the 24 units. And after the first 2 days, I really felt like I was having the placebo effect, because I woke up one morning and thought, I slept through the night and didn't have any pain. And I was able to move my shoulder more than the 10% that I was giving. I only had 10% ability in that shoulder.
Wow.
So as the week went on, I realized this is not the placebo effect. I'm actually starting to get rotation back. And I can actually put my hands over my head now without any pain. And the only disappointing thing with the stem cell is I play guitar a little bit. It didn't make me a better guitar player. I just am really disappointed about that, because I thought for sure some of it would bleed off into my brain, and it didn't happen.
Oh, if that worked, I'd be the next patient in New York.
I would want more. I would invest any amount of money.
Well, I keep buying better guitars, but somehow I don't get any
I know.
better.
Throw money at the problem. That's what we all do, and it never gets anybody better. I do the same thing.
So you started noticing within days the difference, and now we're 3 months down the road. So where are you at now?
Huge difference. I'm at 70% motion. I've recaptured almost 70% of my motion. They told me that, it's not going to be because my shoulder was so bad. And I brought in the CT scans and everything, and they looked at it and went, wow, man. And so I'm hoping for about 80%, getting 80% mobility back. But I'm at 80% pain relief right now. Wow. If I do stupid stuff,
it's gonna hurt.
You're gonna feel it, because this happened in 2011. I let it grind through to 2018. So it's not an overnight thing. And I still feel the stem cells working, because I'm able to do more and more as time goes on. Especially, I'm starting physical therapy to get those muscles working again, because they're all atrophied, and it just really, it's tough, because I don't feel the pain. I want to do the things, And so patience is part of the process.
Yeah, it's got to be a bit of a process to you have to work through all that. And what's interesting is that there's a sort of ripple effect here, because now your career is way extended, it seems like, because you seem pretty young. So as long as your shoulder's holding up, you're good. And as you are in action doing what you do, which is life-saving, your ability to be able to perform those functions, is important for your community that you serve. So there's really a lot of pieces of this that start to say, wow, look at the effects, as compared to saying, now it's a surgery. Hopefully the surgery works. You're out of a career. I mean, the other path is a pretty dismal path.
It really is. And for some people, they feel like that is the only way, that's the only option that they have and the only choice. And with stem cells, that option, there's a second option to help you out. And the downtime, 24 hours. They say, just don't do anything silly for 24 hours. And I hadn't been doing anything silly for two or 3 months before that, because I was done. I couldn't lift weights anymore. I couldn't run on the treadmill. I couldn't do skills courses, which is where we turn out, throw our bottle, pull heavy stuff and do silly things. And we do most of our work on our knees and over our heads.
Right.
I couldn't do any of that anymore. My career was over. And now it's rolling back into where I'm getting stronger every week.
Wow.
I feel that. And the recovery period was 24 hours.
Wow.
Versus a surgery where you're talking 6 months before you start to do physical therapy.
It's interesting because you used the phrase, it sounded like magic,
Yes.
and coming into this, in this whole process and Pain Revealed and exploring all these things on the cell therapy side, I said, it's something that holds promise, but I was a bit skeptical, but I'm hearing too often over and over again, a story such as yours, and especially with yours, very, very dramatic and very quickly. Really something that I think is important for people to be aware of, and I appreciate.
Absolutely.
Yes, I appreciate you, sharing it. Any last thoughts that you might have around it?
If you have any questions, call somebody and ask. Get on, Google it, figure it out. Backs, shoulders, knees, COPD. Folks with COPD. We ran into somebody on a call that. We thought we were going for her, but we were going for somebody else. And her COPD had lessened she said about 50%. I'm probably going 10% because she's still huffing and puffing, but we weren't there for her. And she was pink and looking good.
Wow.
Stem cell is magic. Those cells go in and decide what they need to do. That, to me, that's magic.
Did you report back to your orthopedist? Did you have?
So
tell me, did you go in for a new evaluation?
Yes, I did. I went in and I talked to him, and he said, far out, because he was not wanting to do the surgery. He told me, hey, to get you pain-free, you're not going to be on a truck anymore. You're done. Your career is done.
Wow.
And he's one of these guys that he didn't pressure me or anything. He was pretty excited about it.
How great is that?
It's pretty awesome. And I see stem cell in the future as being the first go-to for orthopedics and everybody else. But that's probably way down the line, because there's money to be made in orthopedics, especially in surgery.
Yeah, and a lot of times, frameworks take a long time to change before new things are adopted. But wow, that's
right. There needs to be a paradigm shift, in all of us, and I've made that shift. I'm a believer now.
Oh, this is terrific. Thank you again so much
you're
for
very
sharing the
welcome,
story.
Doctor. I really appreciate the time that you guys took to ask me some questions.
Chris, thanks so much for sitting here to tell us your story. I'm looking forward to hearing about it. So give us a little bit of your background.
Born and raised in Utah. Great area to be very outdoor oriented and active, and was.
Yeah.
So I've been very involved in sports and the outdoors and my whole life, and in doing so was probably pretty hard on my body. I played college football. I did a lot of hiking and a lot of things, and playing tennis, I started to realize that I am really in a lot of pain.
And where were you feeling the pain?
In my knees,
Both
mainly.
knees?
And I thought, after a while it got to be to where I couldn't really exercise. I tried to play tennis. I tried to wrap it up, and it just got unbearable. And so I first went to see an orthopedic specialist just to see what it was, got x-rays. They looked at it, and my left knee was bone on bone. There was nothing to impede the grinding of bones and the pain. It got to be to where I could hardly walk.
Wow.
And I just thought, I have got to do something about this. So talking to them, kind of traditional medical approaches was, you're really where we can try some injections of kind of different types of protein things that are out there on the market. We've seen marginal results, et cetera. Tried that, no effect really. The next step was knee replacement. I was like, no.
Yeah, it's a fairly radical procedure.
Yeah, and I've had friends that have gone through it with some good results, others not. It just seemed like such an invasive way to go about dealing with my pain, and I just wasn't sold on it. So just kind of randomly had heard, I'd known about stem cell, but I didn't really know where it came from, how it worked, what would be the process, and just kind of real randomly, is the only way I can put it. I actually, on something on my phone, saw a little thing, East West Health, there's a seminar, and it was like, really? That's so unconventional.
Yeah.
Especially for me, and I'm a bit of a cynic. I mean, I everybody's got something to sell.
Yeah.
And I thought, well, I'm in a lot of pain, and I haven't found anything else that does any better job of remediating it. So I went and sat in on it and had all the kinds of questions that you have with something new. I mean, I was fascinated by the organic and natural nature of it. I thought, if this really works, this is amazing. Why haven't we been doing this for years?
Right. What were some of the questions you had?
Well, is it real? Is it snake oil? I mean, it's not from a doctor, so how could it really be approved and really work? We're trained to think that way.
Sure.
That if you can't go to the pharmacist and pick something up to remediate your pain, it must not be really real.
Right.
So I thought about it, and I thought, well, I'll think about it. Because it's kind of, it's not an inexpensive process. So you really, in my case, it was like you really got to be all in.
And you're paying out of pocket for this, right? Because
Yeah.
the insurance doesn't cover
Yeah.
it.
So it's like, but I just had a feeling that their kind of holistic approach to it, not just the origin of where these stem cells come from, but the whole conversation about changing my diet and getting inflammatory foods out of it so that I'm not defeating the value of these stem cells. Acupuncture, something I'd never tried, never heard of. I mean, I'd heard of, but never, not on me.
Right.
That it's all kind of being done together.
And that was kind of the approach. It wasn't just saying, hey, we're just doing a straight injection and we'll see what happens.
Good luck.
But it's kind of like incorporating multiple things at once to try to get your body to heal.
Yes.
Yeah.
Yeah, and I thought, well, that seems really rational, and also the other thing was, a big component of it was your attitude. And your,
Well, talk to me about that. What do you mean about your attitude?
well, not to kind of be quirky about it like a belief system thing, but it really kind of is. I think your mind has an amazing effect on how things work in your body.
Well, in traditional medicine, you either do controlled clinical trials, and a part of that control is placebo.
Right.
What you believe will impact and can impact the outcome.
Yeah.
So sure, that makes sense.
So I went ahead with it. I thought, you know what, I'm going to give it a try, because the alternatives for me were not great.
Right.
And it was like, I'm willing to try this. What, aside from money, what do I have to lose?
Right.
So I did, you know, and a couple of weeks in and the diet and stuff. And worst case, it was a very expensive weight loss clinic.
Right.
Because I was eating better,
Yeah.
I felt better. And it was like, but my knee's still limping along. But it's like, well, yeah, but I mean, these are there's a couple of million of these in my knee trying to figure out what they need to fix.
Right.
And so I'm buying in.
So was there a expectation set for how long it might be before you start to notice any effect?
Yeah, they told me probably 4 to 6 weeks. So that helped because it was like, well, you know, do the diet, do the acupuncture, try to remain positive, right? And all of a sudden, about 4 weeks in, I'm thinking, I really feel like something different is going on in there. 6 weeks, even better.
Wow.
You know, I went from, on a scale of 1 to 10, pain being in the 8, 9
Wow, that high
range.
Were you taking
it was
medication to try to?
Yeah, like, you know, things over the counter things, but I didn't want to take anything that was prescribed for pain.
Right.
So I realized, though, that there were some very natural remedies for anti-inflammatory things. And so I started to use those as I was changing my diet and as these little stem cells were starting to work. You know, I had to kind of lay off physical activity for a bit, but pretty soon I was walking without a lot of pain, and it was, you know, 3-4 months in, I'm feeling like this really works.
Wow.
I can feel a difference. You know, I was down more in the maybe 3-4 range, where occasionally I'd be my knee would be kind of stiff and sore, or I'd stand a certain way, but it progressively improved to where this was 10 months ago.
Okay.
So, you know, 6-7 months in, I felt like I was 10 years ago.
Wow.
With the way I was able to move, the pain. I mean, I'm 61, so it's sometimes you kind of expect to have pain
Isn't that
and
what's put
discomfort.
in your head? It's like, oh, well, you're getting old. That's,
Yeah,
so
it's just part of the deal.
Live with it. Yeah.
It's not part of the deal. It's really not.
Wow.
And there are some really natural options I found.
Yeah. So 10 months in now, are you active again? I mean, are you playing?
Oh, yeah.
Okay. So talk about that.
Probably last 3-4 months ago, I started playing tennis again, elliptical. I'm able to exercise, and that was one of the detriments. Was my knees hurt so bad I couldn't exercise.
And that starts the whole downward spiral. You stop
yeah.
exercising, weight comes on,
Yeah.
and then, more pressure on the knees.
Absolutely. And you know, you just don't feel good about yourself. You feel lazy and kind of heavy.
And that's one of the things that talking to many patients now through this process and kind of finding out what their experience is. A lot of them say that, hey, once it started going downhill, the constant pain and the lack of exercise and movement created sort of a depression for them. Did you notice anything like that?
Oh yeah, this was a life changer. I mean, it was like and I'm an upbeat guy. I'm very active and very positive, and it was like this is dragging me down. Yeah. Not just physically, but it was just like, there were so many activities. I couldn't ski. I couldn't wakeboard. There were things I was so used to always being able to do, and it was just that was depressing.
Yeah, I guess it would have to be. So now 10 months in, you're able to challenge the knee. I mean, you're playing tennis and doing activities, and it's still holding up. I mean, at this point, you're still seeing that your pain is way low, and you can do what you want to do.
Yeah, and that was the cool part. Was I expected there, at least I can do it, but I'll probably pay the price. I'll probably be hurting for a few days.
Yeah.
Not really.
Wow.
Not really. Not any more than, if I was completely healthy, let's say.
Yeah.
You're older, you get stiffer, whatever. So I believed in this so much that, because I thought, if it can grow bone on bone, like bone on bone, if it had a little bit of a base that it's built up over these 10 months. So I came back in just a couple of weeks ago, and had a booster in my left knee and kind of a preventative in my right knee,
Wow.
which isn't experiencing a lot of pain yet, but it's where my left knee was probably 2 years ago.
So basically getting ahead of it, was
I
a good
think
idea.
so.
Yeah.
I think so.
Wow.
And it forced me back on the diet, which is good.
Yeah, that is good. Any downsides? Is the procedure itself painful at all?
No, a little bit of pressure. And acupuncture isn't painful, which is hard for me to understand. But it really, I'm starting to kind of sense how it works now that I've done it enough times. And I think somehow, some way between all of it, the way it works, for me, it's been an incredible journey. And it's emotional a little bit because I got my life back,
Yeah. Yeah, and that should be emotional. I mean, because it's not just a matter of being alive; it's being able to live, right?
Exactly. Yeah.
So I'm very appreciative of the fact that you're willing to come and share your story and understand, the depth of the impact it had on you, and hopefully it can impact other people. It's interesting, because I always walked into this a bit, skeptical. I wonder, what's really here, et cetera. And I'm talking to people like you, and I'm finding out, wow, there's lives really being changed every day.
Yeah.
Any final thoughts?
It's a very credible solution. Now anytime I start to feel like, my shoulder or whatever, it would be the first solution I would go to now because I just feel like it's such a natural, organic kind of solution to our health and to manage pain.
Well, that's terrific. Well, I very much appreciate you sharing your story, and I wish you ongoing activity in your life and pain-free activity.
Yeah.
And I'm sure now that you're on the right path for what you need.
Yeah, I got my life back, and I can live it. Yeah. I can live it the way I want to live it. I'm not through hiking. I'm not through playing sports, working out. That's what keeps us young, right?
Yeah, exactly. Well, thanks so much, Chris. I really appreciate it.
You're welcome.
So, DJ, thanks very much for taking your time with me.
Absolutely. Thank you for having me.
So, what was your experience? What was the health challenge you were having that caused you to want to seek this type of self-treatment?
Yeah, so actually my mother was adopted, and as you know, people that are adopted, they don't really know their entire medical history.
Right.
So when I started learning and digging into stem cells, I learned that a lot of people traditionally go in because they have a certain ailment, but then I learned that a lot of it also can be for preventative. And my heart has always been my number one thought because the unknown of no family history on that side. And so I came in for preventative initially, and they did an IV and did the whole preventative. But then while I was here, I went on a hike on Mother's Day and got a blister, and it healed, but bacteria got in and it created cellulitis.
Wow.
And it deformed my ankle. And so my wife was at the preventative meeting with me. She's like, hey, why don't you have them also inject into your heel? Because cellulitis deformed it. And I like to work out. I'm very active, and there was a lot of pain, so I couldn't do a lot of that. So we injected it, and within about 3 weeks, it healed about 90+% and went back to normal form, if you will.
Wow.
And now I'm back to working out. And,
were you expecting that it would go back to normal form?
No, I didn't know what to expect. Because initially I came in for the preventative,
Right.
and then she brought it up while we're here. Let's inject. I said, yeah, why not? What do we have to lose?
Right.
And there's pain walking on it constantly. Like if you would have looked at the before pictures, you'd have been like, how could you have walked on that? And leaving the clinic, I don't know if it was the needle going in or how quick the response was, but it felt better leaving the clinic.
Wow, so that's really unusual. I mean, some people talk about response in days. I think the expectation are normally given by their clinician is maybe some months. But you're saying literally had the injection, you noticed it before you walked out the door.
Yeah, there was a lot of pain, and maybe with the needle releasing some of the stress on it while they were doing the injection helped out too. But within about it was over 90% back to normal formation within 3 weeks. So it's been great.
So you're the first person I spoke to who said, hey, I had some of this done just for preventative purposes.
Yeah.
Did you notice anything when you did that? I imagine it was an IV. They didn't inject in any particular place. They just put it in IV.
It was an IV.
Yeah.
And also, when I was 28, 13 years ago, I had back surgery. I had a bulging disc, L5-S1.
Yeah.
And, it would always come back periodically, some aches and pains. And since September of last year when I had the treatment, I haven't had any pains come from like heavy lifts or working out or sitting at long periods of time. And so, that I have noticed. So I would assume there's a little correlation with that.
Yeah, it probably is. And that's still to this day, it's you're not noticing anything from your back.
No.
Anything else that you might have noticed from the preventative side, or you just feel good about the fact that you got it in there and hopefully it's doing some magic?
Yeah, so far so good. It's, I don't notice anything that I didn't know what to expect or notice, but I feel good, and the back's feeling good, the foot's good, and the preventative was great.
So what about the foot? So has it digressed any, or the healing that happened there, it's held up? Or?
Yeah, it's maintained. And like I said, I work out, I run, multiple miles every day, 3-4 days a week.
Wow.
And when I used to run, I'd have to come back and ice it, and it was in a lot of pain. It would stiffen up, and I don't have to do any of that anymore.
Have you been recommending any of this to people or friends?
Yeah, I share my story with everybody, especially, people I run into and they talk about stem cells. I definitely share my story out there. I think a lot of people are getting more intrigued by it. It's getting more mainstream, verbalizing out there throughout the social media scene.
So what do you think the expectation should be for someone who's looking to get this type of therapy? They're suffering with pretty bad pain. Maybe it's acute, most likely chronic. They maybe are surgical case, that's been recommended for them. And they're going into this. Do you give them kind of like an expectation, as you're recommending it that you might set for them?
Yeah, I mean, because there's always two sides to a coin, right? And I learned years ago, a mind's like a parachute, works when it's open. So many people come in with the excitement of what's possible, but also in their back of their mind the uncertainty.
Right.
And what I always recommend is surgery's been around for a long time.
Yeah.
Stem cells have been around for a long time, but it's getting more popular. And definitely get an exam from the doctor and get 100% of the facts so people can make the right decision.
Right.
You got to have 100% of the information to really make an intelligent mindset on what you want to do with it.
But at least it makes sense to get a consultation, so your options are, right?
Yeah.
Especially if you're looking at something like surgery, or if you're somebody who's living with a lot of pain and a lot of medication, et cetera, it's an option to explore, in your opinion.
Yeah, you don't know what you don't know.
Yeah.
So I definitely recommend at least get an exam and bring all your x-rays and MRIs and all your medical history and come learn and get educated by factual information, by data that's actually working out there.
Right. Well, DJ, I really appreciate you sharing your story with me, and really interesting that you're the first person I spoke to who said, hey, I tried it just for preventative purposes. I hadn't seen anybody else do that, so that's really great to know.
Yeah, thanks for having me. I appreciate it.
As far as I'm concerned, the rubber meets the road in the patient's results. We can talk about all the academic, all the research, all those things, but in the end, how did it affect someone who was seeking help? And that's exactly what we got to experience. Well, that concludes episode 1. I hope you got a ton of value out of it. Remember, we have a very sincere and strong purpose in getting this information out to the world. We're just at the very beginning of the Pain Revealed journey, and I'm asking you to share in our purpose by sharing this with other people that you know that you think can benefit from it. There's a lot more content coming, some really phenomenal information that can change lives. So thank you for being on this journey with me, and please do share it with other people, and I look forward to seeing you in episode 2.
People are looking for something that is more curative,
Yeah.
of fixing the root problem versus taking a pill that's
Right.
masking the symptom.
Right.
I think that there's starting to become a big shift with our population that is seeing the pharmaceutical companies. It's not the answer. You're not fixing anything. And regenerative medicine is becoming more of a standard of care as we move farther into the future.
Pain is just simply the stagnation a blood flow in your body. And so by putting acupuncture needles in specific areas of the body, it just influences the blood flow. Just getting the blood flow is going to help heal a lot of the pain conditions that people have.
It's one thing you could say it's a placebo effect, but it's placebo effect when you create an expectation. In this case, there was no expectation. These are unanticipated benefits. So I started looking saying, wow, there is something maybe more global that's happening in the body that's more part of the story.
I'm not going to have expectations. I just like to see some of the pain gone. I mean, I live in constant pain 24/7. I do anything and everything trying to ease the pain. I've been on painkillers for 15 years. January last year, I started weaning myself off of it against my doctor's orders because the pain is so intense. But I'm trying to live with the pain, and it's not no fun. You got to work, you got to make a living. They want me on disability. Can't do that. Can't live with disability.